Good afternoon to you, everyone. My name is Mon Senka, Relations Officer. On behalf of the Caribbean School of Medical Sciences, I welcome you all to this, our fourth public lecture. We acknowledge those who have joined us online and those who are in-house here with us. And a very special welcome to our presenter, Dr. Stephen Chang, a member of the CSMSJ academic team, to our Executive Dean, Dr. Neva Graham, member of the academic team. To our Executive Dean, Dr. Balin, Dr. Neva Graham, founder of CSMSJ, former Executive Dean, and currently our Chief Development and Finance Officer. Also, Ms. Daniela Hyde, our Registrar, members of staff, students, family, and friends, a warm welcome. We at CSMSJ have embarked on a series of monthly lectures with our own local and international presenters for this year, and we are honored to have Dr. Stephen Chang, our fourth presenter in the series at this time. Recently, we were privileged to have Dr. Thirlwell, who enlightened us on the topic, autonomic nervous system dysfunction, the root of insomnia, anxiety, and the PSD. That was indeed educational. Then we had a very special guest, Dr. Killian, who presented on the topic, cutting-edge assessment and neuromodulation technology that optimize health and can be used alongside medicinal cannabis, which was also enlightening. Last month, we had Dr. Cabrera, one of our board members, or guest lecturer from Cuba, who presented on the topic, Hermanos Americanos, Clinical and Surgical Hospital Postgraduate Teaching. Today, we have our own Dr. Chang, who will be presenting on the topic, Nasopharyngeal Carcinoma. And we look forward to having him. And we ask that you be engaged because there are going to be question and answers after the presentation. At this time, we invite Ms. Hyde for the invocation.
Good afternoon, everyone. Let us pray. Oh, Heavenly Father, we want to thank you again for allowing each and every one of us to have such a beautiful day. I ask that you cover these proceedings under your blood. We ask that you cover our speaker under your blood. In all that he is going to present this afternoon, we ask also that you cover each and every member that is here, both in person and online, that you will continue to guide and encourage and be a light in their surroundings. In your name I pray, amen.
This time we invite Ms. Wright to introduce us, presenter, speaker, Dr. Chang.
Thank you, Mrs. Guy. Dr. Stephen Chang is a retired consultant ENT surgeon with over 30 years of distinguished clinical and academic service. A graduate of the University of West Indies, UWI Mona, he holds a Bachelor of Medicine, Bachelor of Surgery, and a Doctor of Medicine in Otorhinolaryngology, Head and Neck Surgery, Dr. Chang has made remarkable contributions to healthcare in Jamaica through surgical excellence, teaching, and mentorship. Through his career, he served as a senior ENT consultant at Kingston Public Hospital, where he trained medical residents and supervised postgraduate nursing students in ENT care. His professional journey also includes an elective at Royal National Throat, Nose and Ear Hospital in London, under the mentorship of world-renowned Professor Donald Harrison. This experience further refined his clinical skills and broadened his exposure to global best practices in ENT and head and neck surgery. Dr. Chang previously operated a thriving private practice at Andrews Memorial Hospital and held key residency positions at the Kingston Public Hospital, the University of the West Indies, and the Bustamante Hospital for Children. In his early years of his medical journey, he worked alongside public health pioneers such as Dr. Hibbert Elmeyer and Dr. Barry Wint, gaining valuable experience in general medicine and public health. In addition to his medical and academic contributions, Dr. Chang has played a pivotal role in physician and advocacy. Dr. Chang is also a passionate educator, currently applying his knowledge to medical education in histology and anatomy. His teaching is grounded in real-world surgical experience and a commitment in bridging clinical and foundational sciences. Beyond medicine, Dr. Chang is a devoted Christian, a loving husband, and a father of 3 children and 2 grandchildren. He is actively involved in missionary and evangelistic work and believes strongly in giving back to his community through faith-based services and mentorship. Help me welcome Dr. Chang.
Good afternoon. It's really a privilege to be here presenting at the CSMSJ and regular public lecture. And I just want to thank all the administrative staff, the other members of staff for allowing this presentation to take place. And most of all, we thank the Lord Jesus Christ, our Savior from sin. So this afternoon, we'll go ahead without any further ado. I'm presenting some aspects of nasopharyngeal carcinoma. And as we view the first slide, we can see that under the title of nasopharyngeal carcinoma, and I must hasten to add for those who may not be medically exposed, the carcinoma also refers to a form of cancer arising from the epithelial lining of what we call the nasopharynx. And it's a very unusual type of cancer. And so if you note what is said on the slide, it says the cancer you have never heard of before. For the majority of us, we have no idea of it, including medical staff, is what I've found. But however, it's a cancer that we need to know about. So yes, there are much more common and familiar cancers, like breast cancers, prostate cancers, stomach cancers, and a lot of people will know about these ones, but nasopharyngeal carcinoma, don't know much about it. We don't even know where the nasopharynx is. Is that part of the body? Someone asked me recently. And so we'll just have a look at the next slide. So nasopharyngeal is a part of the, let us say, head and neck area that we're looking at specifically. Specifically, in particular, we're looking at the pharynx, which is a fibromuscular tube that is actually located posterior to the nose or nares. starting at the level of the skull base. So this pharynx goes all the way up to the skull base. And the nasopharynx is the first component of it. The nasopharynx runs inferiorly and it ends at the level of the throat or the oropharynx, which in medical parlance we will understand that the oropharynx is actually at the level of the first and second cervical vertebrae or the bones that support the spinal cord in the neck. Next slide, please. So as we look at so this is the anterior nares. We have the lateral wall of the nose extending into the nasopharynx. This is the nasopharynx here. Doesn't look like much on the diagram, but it's an exceedingly important part of the body. And I'd like you to note this particular portion here, where it says opening of the auditory tube. Very important structure. That auditory tube is also called the eustachian tube. It connects the nasopharynx to the what we call the tympanic cavity or the middle ear cavity. So it runs from the area behind or deep to the eardrum and opens into the nasopharynx. So this is actually representing the level of the nasopharynx in which it opens into. May not be 100% accurate, the diagram, but it is representative and it's sufficient, I believe, as this is the actual, what we call it, turbinus or the bony structures in the lateral wall of the nasopharynx. We have superior, middle, and inferior. And normally you'd see that the opening of the eustachian tube in the nasopharynx is actually at the level of this inferior turbinate, which is the most inferior bony structure in the lateral wall of the nose. So can we go to the other part of it? Now, this is what we call a coronal view extending from superior to inferior. And we're focusing on this tube here. It's the same auditory tube, or what we call the eustachian tube. This represents the opening of the eustachian tube in what we there. Sorry about that. Right. So we make it a bit larger. So this is a middle ear cavity going into the middle ear cavity, going into the inner ear. This is the eustachian tube opening into the middle ear cavity. And this is the other end of the eustachian tube. Now, if you pass your memory back to the previous picture on this slide, you would have noted that the opening of the eustachian tube in relation to the pharynx or the nasopharynx, you would have seen that on the lateral wall of the nasopharynx. So this is middle ear cavity, tympanic membrane, ossicular chain, important for not transportation, but conduction of sound from the tympanic membrane to the inner ear structures. And this is the, oh boy, this is the nerve, vestibulocochlear nerve in that area. Goes to the brain. The next slide, please. So another, right, this is on MRI. So it's a coronal representation going from superior to inferior at the level of the nasopharynx. So this is more actually related to where the nasopharynx ends. So this is the uvula, the structure in the roof of the mouth. This is at the relation of the, as we call this structure generally, that area of the pharynx, so we call it oropharynx, or what is called loosely as the throat. This will be the tongue, the back of the tongue, the posterior third of the tongue. So if you imagine, you're looking straight into the person's oral cavity, then into the oropharynx. If you imagine that the nasopharynx would actually just be superior to the level of the oropharynx. This is where the nasopharynx will be coming to an end at the level of the throat. So, okay. This thing giving too much. So next slide, please. So we're just going to look at a brief introduction to the epidemiology, which is looking at the problem that we are discussing, which is the nasopharyngeal carcinoma, and we'll abbreviate that by saying NPC. So every time we say NPC, we know what we are referring to. The epidemiology represents special characteristics of this particular condition that can be variable dependent upon which parts of the world that we find ourselves in. But in terms of the NPC, the worldwide incidence of this is less than 1 per 100,000. So question then should be asked, and why are we looking at this? It's just less. This actual incidence globally is quite small relative to something like breast cancer, prostate cancer. It is quite insignificant in terms of statistics. It's a very important issue or challenge if you or any individual comes down with this problem. The epidemiology, as we continue, it varies. The presentation and incidence varies according to the location that you're in terms of the global population. It's exceedingly common in South China, Southern China, especially a province in that area called Guangdong province, with so the incidence in that area is actually 20 per 100,000. So you see the vast discrepancy. The worldwide incidence relates to 1 person per 100,000 of the population, while in this particular area in China, it's 20 per 100,000. Very different. Very, very increased in this area. And we want to find out why that should be the case. In some areas, it's even higher than that in that part of China. And we're not just looking at China, looking at places like Korea, Taiwan, Hong Kong, similar incidences. But in this particular area of South China, related to these two rivers, the Jiang and Pearl rivers, the rates of NPC, nasopharyngeal carcinoma, can reach 25 to 40 per 100,000. Very much higher than what pertains to the global incidence. So let us look at what happens in North African countries. This is important. It has an intermediate incidence and varies from 8 to 12 per 100,000, significantly higher than the world incidence. But let us look at Jamaica, because we are looking at, that's where we are right now. In the incidence in Jamaica is considered low, but significant. It is actually 1.4 estimated per 100,000. Jamaica has a higher incidence than the worldwide population. It's not a lot, but still significant, but it's still much lower than in Southeast China and in North African countries like Morocco, Egypt, those countries, North Africa. And why is this the case? So let us do a little investigation. Next slide. But before we go on to that, we're going to look at some of the causative relationships that we think may be associated or even causative to this NPC challenge. Topping of the list is the genetic factors, and we'll go into that a little bit more. But quite important is this one here, chronic infection, especially to do with the Epstein-Barr virus, which is a double-stranded DNA virus, which is endemic in most parts of the world. So it's a very common problem, this EB virus. It causes conditions like infectious mononucleosis, often called a kissing disease. So this is a significant issue and presents often, this infectious mononucleosis presents between the age ranges of 15 to 24 years old. But it has been shown that even very young children will have this EBV virus in the side of their blood, stream the DNA for it. So it's not an insignificant issue. It is quite important. And the EBV virus has been known, well documented to be not just associated, but is now thought to be causative for NPC, along with some other things like blood cancers, like lymphomas, even a special form of stomach cancer is associated with this EBV virus. So it's not a simple or insignificant issue. We must take it seriously. Lifestyle factors, another etiological factor. Careful who we kiss. Be very careful how we use or even expose ourselves to things that are communally shared amongst people. Utensils, other things related to the kitchen, dining room area, be very careful. So a word to the wise will be sufficient. And we have environmental factors, toxins in the environment. Some things like smoking, cigarette smoking. No question, right? Very important. Cigarette smoking, other industrial toxins, which are so wide we can't even start to mention them. But all of these factors thus far are clearly associated with nasopharyngeal carcinoma, NPC. I'm going to skip this one a little because in my mind, this is the most important one. Gut and oral microbiome. We'll talk about that. There's also a family history. So if you have a first-degree relative who has NPC, your chances of getting it are significantly higher. Age and gender. Age, it has a bimodal presentation. Young people, the youngest patient that I have had to deal with historically at the Children's Public Hospital, Boston, the Children's Public Hospital in Jamaica, was 3 months old. Nasopharyngeal carcinoma. It has a bimodal presentation, meaning that it will affect young people and it will affect older people. It's more common to affect people like in their 6th decade, 50s going up. Gender, males tend to be affected more than females in a 3-to-1 ratio. So the males, and it's so unusual because the only other cancer or carcinoma I can think of that is so gender related in favor of males is prostate cancer. And we all know why that is. Females don't have prostate gland. So This particular disease, there are a lot of questions associated with it. Next slide, please. So we're talking about the HLA antigens and NPC. HLA antigens, this is now the genetic aspect of the problem. Human leukocyte antigen. That's a big word, and we're not necessarily going to go into that right now, but we have seen that, look at this, especially in southern East China, this particular version of this HLA antigen is particularly common. It increases the risk significantly of NPC, but they have others, HLA-A2, B46, A33, and B58, increase the risk of NPC significantly. The good thing of it is that there are also other types of antigens or alleles or whatever we want to call it. We're not going to go into that now. What is it? That actually give you a decreased risk. So if you have this on your white cell, the leukocytes, HLA-A11, B13, B27, and B14, those offer you a decreased risk. And we say thank God for that. Next slide, please. So we're just going to go into now what I think will be eventually shown to be the most important factor in this problem. So the slide says the oral and gut microbiome. What is it? Next slide. The microbiome can also be termed to be the flora. So the microbiome actually represents microorganisms that live, and in this particular case, in the mouth and in the gut. And we'll see how important they are. But we want to understand a little, give some information about this particular oral gut flora microbiome. The important word here in this slide is balance.
Yeah.
So the microbiome represents normal bacteria primarily, which reside in the gut and in the mouth, and they have to be there to balance this ecosystem that is flourishing in our guts especially. So the ecosystem represents microorganisms which interact with their environment. And so we have actually this part of our body in our gut and oral cavity to a lesser extent has now been termed the second human genome. Very important. It is crucial for health, normal health, and it helps to fight disease. Very important. Next slide, please. So as we continue on this a bit more, the oral and gut flora, they have to be balanced to avoid overgrowth of bad bacteria. We have more gut bacteria genes in our intestines, stomach, mouth, than genes in the human genome. It's estimated that the human genome consists of 20 to 25,000 genes. But these gut bacteria outnumber our human genomes or genes by at least 150 times, up to 3 million it has been represented as. The gut flora has been shown to affect every system in the body. Next slide, please. And so, could you enlarge this one? Right. What are the functions of the gut microbiome? So if you look at this will, oh dear, what's going on? So these are the bacteria inside the intestine. Can you enlarge it a bit? So some of the functions, these are normal functions of the gut microbiome. They help to break down food and absorb food, nutrients. And as a result, will affect height and weight of individuals, depending on how well they are functioning. The most important part of this slide is this one, I believe. There is what is now very clear, that there is a connection, an intimate connection between the gut and the brain. It's called a gut-brain axis. In fact, a lot of physiologists will tell you that inside your gut represents your second brain. Most of us have the first brain upstairs, but this one is in the gut. So going along with the other functions, they produce a lot of chemical substances that protect the lining of the gut. Now, the lining of the gut is key because anything that transgresses this lining is taken by the blood vessels all over the body. So we don't want the normal integrity of the gut lining to be broken down. The gut bacteria, the gut flora, the gut microbiome protects this. There is an important function that it has in the modulation of bone mass density. And that, I think, speaks for itself. But remember that as females get older, the bones become a little weaker, less dense. So this is why this is so important, because it has been shown that these things actually, the gut bacteria actually speak with the rest of the body, communicate with the cells in the rest of the body. So you can imagine now, God is so good as our creator, that these gut bacteria which are there, talking to the cells in the bone. And it's saying to them, well, look, you have to start functioning properly. And what they're going to do about it. So as we continue, this is an important
next week is good
function.
because I'll still be on
Bacteria, gut
vacation.
microbiome,
Yeah.
they help in the
So which day?
formation of new blood vessels. And remember, the blood vessels carry blood. And blood, the word of God says, represents the life in the body. So without that, you will be dead, basically. Go to this one, please. As you go along, important function is that it helps to break down, the gut bacteria helps to break down medications, if you're a fan of those things. So the other thing is that fat storage, you know, this is not necessarily a good concept for some of us, but in terms of body mass and fat indices, gut bacteria play a role. But this is the one I want to focus on as well. The modulation of the immune system. Not only does it control the function of the immune system, but the microbiome actually represents an important area for the development of the immune system. The ability of your body, our bodies especially, to differentiate between cells and non-cells. Although there is a new category being thought of recently called the empty self syndrome. That's another thing. Another aspect of the normal function of the microbiome in the gut, primarily in the gut, but also important in the mouth oral cavity, production of essential vitamins and minerals. Vitamins like vitamin B1 to B12, for example. Sorry, other things like various minerals. So we can go to the next one. The next, yeah, on the same slide. Yeah. So this is just to follow up on that previous graphic. It says 5 facts about the gut microbiome. This, I believe, the gut microbiome will be shown to be eventually shown to be even more important than the other factors that we discussed when it comes to NPC. 5 facts about the gut microbiome. That's how we're looking at it. The gut microbiome, there are 10 times the number of microbial cells in the human gut than in the entire human body. So the diet that we hold to plays a very important role in the development and normal function of the gut microbiome. That's been shown, by the way, that animal flesh and its pervasiveness is really not the best diet, but that's another discussion. So what we need to understand is that diet will vary as well between various populations. So if you have in any country, you have the urban populations in the city, the diet that folks partake of generally in the cities, they are processed foods generally, while the people in the rural areas tend to have a more generic and diverse diet. And so even if you compare population developed countries versus developing countries, it still applies. So as we go to the other things, now fiber in our diet. The diets that generally pertains in the cities tend to be lacking in fiber. And there's this concept that the gut bacteria need the products, breakdown products from fiber to feed themselves. So if we are not providing them with it, then they stop working properly because they expect you to feed them. So the fibers, including what they say, food-based resistant starch, like green bananas, for example, are some of the key nutrients for promoting normal activity of the gut microbiome. This one. Another aspect of it, very important, gut bacteria are involved in harvesting energy. Energy. You can't do much without energy from food. Balancing the good versus the bad bacterial composition, very important because it affects our normal metabolic function of everybody. Everybody's body. Next slide, please. So just want to look a little about the oral flora. Not very well studied. Oral meaning oral cavity, mouth. But I think we all know that every cavity in our bodies have bacteria and various other organisms in them. Well, look at this. In non-smokers, they are much more viable than smokers. Smoking kills off your regular bacterial levels and put you at risk for nasopharyngeal cancer. And you realize how close the oral cavity is to the nasopharynx, which is also very close to the brain. So next slide, please. Yeah, just go down. This is gingivitis, loads and loads of bacteria. And you find that the gingiva that covers the bone eventually becomes destroyed, and eventually the tooth or the teeth themselves also are affected. So we want good bacteria in our mouth and in our gut. So be careful of the practices that we do in our regular lives. And I'm not going to say anything more about that. Next one, please. So we want to have a diverse population of bacteria. So our diet tends to affect that. So we have to be very careful. Next one, please. Next slide. Please. Gut flora, well, this is one is hard to see. But look at this. What is this? HPA axis. Hypothalamic, pituitary, adrenal axis. Very important connection in normal physiology. Gut bacteria impinges on it. So the brain controls everything. We know that. But it seems to me that the gut bacteria is controlling the brain too. And that's a very interesting concept. Very important one. LPS, these are components to do with the bacterial cell wall, which actually can actually leave the gut through this thing here, up some more, called a leaky gut, where the normal connections between the enterocytes or cells in the gut, they are broken down and they allow transgress movement, relocation of these lipopolysaccharides, these components of the bacterial cell wall, to travel all over the body, creating chronic inflammation. For those of us who are not aware, it has been shown very, very clearly now that inflammation, chronic inflammation drives most, if not all, chronic diseases in the human body. So this is why this gut bacteria situation is so important. Eubiosis, EUBIOSIS. That's where it balance, everything functioning well. Dysbiosis, DYSBIOSIS, everything starts break down and you get leakage of stuff all over the body. Now, this particular slide is important because we find a lot of clinicians do not regard this process as being important. I truly believe they are ignoring a very important aspect of our bodies. Next slide, please. So it says, what do gut stroke flora? Flora represents the population of the gut bacteria. It may even be fungi, may even be parasites, everything like that. Have to do with nasopharyngeal cancer. Look at this. Very much. It has a lot to do with it. But it's not just that. It's been linked with most cancers now. Gut is vitally important. Normal functioning of the gut, normal functioning, diversity of the gut flora, key to maintaining normal health. Recent research, very clear, making this concept very clear now. Clinicians need to catch up with what is happening in the research areas. This is a very, very clear concept now. Lots of clinicians reject it though. And I believe, in my humble opinion, it may well turn out to be the most important factor for cancers in general. Not just nasopharyngeal cancer, but for most, if not all, cancers. In time, I believe it's going to be shown to be that. Next slide, please. So lifestyle factors, and this is something that is quite controversial. But the first part of the slide says, this nasopharyngeal carcinoma, looking specifically at lifestyle factors, it's associated with regular eating of dried and salted fish. Regular eating of dried and salted fish. And we must be beware of nitrites. Nitrites are compounds that often are produced in the body as a result of eating these things. The interesting thing is that people from South China, this is what they tend to eat: dried and salted fish. And before I go on to the next one, I just want to elaborate on this. Jamaica, our population mainly initially came from West Africa, Ghana, and the same thing happens there. Dried and salted fish, they call it stockfish. In Jamaica, as I was told, corrected actually this morning. Our national dish is not just ackee and saltfish, but it's ackee and saltfish and dumpling. It's not right. So no, don't move yet. So I am not going to just elaborate on that any longer, but going on to this EBV virus, quite frequently spread by sexual practices, as well by sharing things that we shouldn't be sharing. So be very careful. But the EBV virus, Epstein-Barr virus, has been noted now to be a causative agent in NPC. So we need to look at our social practices. Cigarette smoking, alcohol, also very important in the causation of NPC. Cigarette smoking and the imbibing of alcohol. We note that a large percentage of our younger male population, they tend to smoke a lot and they tend to drink alcohol a lot. And you must be careful of environmental toxins. All right, let's go. Next one, please. I have to catch up on time. So we're going to look at some of the clinical presentation. Because one thing to know about the disease, but we want to know how it presents, what makes it so important. We need to understand one thing about this cancer. It is a great mimicker. It has protean manifestation. Protean means multiple, varied, diverse manifestation. So it will present even to the regular doctor, and the doctor can't figure it out because it will take the appearance of more common, regular disorders, which are not that serious. The doctor will tell you, say, no, you don't have no serious problem, when you really can have. So, hence, because of that, the diagnosis can easily be missed and make it worse. What makes it worse is that the cancer might be present and the doctor, say it's an ear, nose, and throat doctor, or even a regular doctor who has a nasal endoscope can look at the back, may not see it because up to 30% of them can be below the surface. So you see the problem? It's a very tricky something. And who suffers in all of this? See there? Patients suffer. So the clinical presentation, early and late. So you have early presentation, late presentation. The majority, though, present late, advanced stage of cancer. They are mainly related to the head and neck area. But we shall see that it don't necessarily have to be that. This represents an early finding. So if you or anyone for you find that you're not hearing well, and you're not having no pain in the ear, do not allow the doctor to tell you that you have an ear infection. So you don't. Because often they don't even examine the ear and they come to a diagnosis. Unfortunate, but it is true. It's another common symptom. So going back to this though, why would you have decreased hearing? Because if you cast your memory back, that eustachian tube that connects the middle ear cavity to the nasopharynx, which is what we were talking about, it becomes blocked, abnormal in function, and you develop what we call a fluid in the ear. Fluid in the ear, but alas, most doctors cannot diagnose that. Unless they see it regularly, they will never be able to understand or appreciate what is really happening. But the problem is that SOM, which is serostotitis media, is not infected. There's no pain. We have a fluid collection in the middle ear cavity, decreasing the transmission of sound. So you get what we call a conductive hearing loss. Well, look at this. Epistaxis, nasal bleeds, common presentation. So if you're having a slight nosebleed or even a heavy one, please don't let the doctor just tell you sinusitis. Go home and take this and that and that. Ask them to send you to the ear, nose, and throat doctor. Persistent sore throat, very important presentation, early. And painless neck swelling, very early, normally a presentation. Painless neck swelling, where the lymph nodes in the neck swell up. And the doctor don't understand why it has to be like that, but that is often an early presentation, meaning that's the first time the patient comes to the doctor. But the tumor would have been there from a while before that. So it might be early, yes, but it's only early in terms of when the patient presents. Next slide, please. Looking a little bit more on this. More clinical features. These are more advanced areas that get involved, or advanced presentation, advanced disease. You often get multiple cranial nerve deficits. In Indonesia, and in that part of the world where it's very common, a sixth nerve palsy with diplopia or double vision is often the clue that suggests to the doctor this is what he's dealing with. But any cranial nerve can be affected, anyone. And we notice, we didn't say this specifically, but the superior aspect or relationship of the nasopharynx is the base of skull. So if you have a growth inside there, like a cancerous growth, it can actually find its way into the brain area through one of the openings called the foramen lacerum in the base of skull. Oh dear. So invasion of the skull base, quite important. In fact, I remember one of my mentors when I was going through said that, and I believe it is the case, that at Bellevue Hospital, it had been shown that a lot of the patients who were there who had abnormal behavior turned out to be having nasopharyngeal cancers. So be very careful. It will cause a space-occupying lesion in the brain. When it reaches to that point, obviously it's going to be more demanding. So there's a nerve that runs in that area called the videal nerve. It supplies normal function to the eyes and nose. If this is involved, it stops functioning or decreased function, you get dry eyes and nose. Quite frequent. So overall, what we see is that NPC is a great mimicker. In my time in med school, they used to say syphilis was the great mimicker. Then it went to systemic lupus. But I truly believe that this particular one, NPC, is a great mimicker as well. So the clinical diagnosis of NPC is often delayed for months. By that time, the horse has already gone through the gate. Far advanced. Next slide, please. So we're not trying to frighten anybody, but we need to be aware. Now, this particular slide shows some of the various pathological types. Not that important for this presentation, but we also want to note, you see? Well, can increase it, please? Make it bigger. Note this, EBV infection, Epstein-Barr virus infection. Notice again, EBV infection, Epstein-Barr virus infection. Up a little more. This one should also have it. But for the three main types, type 1, type 2, and type 3, they are all generally associated with this viral infection. Of late, the classification of types have changed a bit. So this, where is it? This one here, the bottom one, this is a more recent type that has been identified, but now they think it's part of the type 3. But some people will say that this really should be placed in their own classification. It's rare type, but it's very aggressive, very poor outcome. And the classification is still not uniformly accepted because people looking at it still. Next slide. So type 1, type 2, and type 3. Of the various types, most of them strongly associated with the EBV infection. So why do we need to be aware of it? Hey, Dr. Chang, be real. This is not a common some problem. What is the big issue about it? Let us see. Next one. It is not a rare cancer in Jamaica. As we saw, the incidence in Jamaica is a bit higher than that of the worldwide incidence. So that should ring a bell and make us be careful and want to know about it. It has many and varied presentations. It can be life-changing or lethal. The death rate is significantly high. Early diagnosis is vital. Problem though is that many doctors have never heard of it. They're not aware. And it's even worse, I find, amongst the nurses. They don't have a clue about that, generally. Unless they are passed through the ear, nose, and throat service in the various institutions. Oh. So often the wrong diagnosis is made by the primary care doctor or nurse. The public need to be aware and keep the doctors on their toes. Education is vital for all groups. It is never too late to learn, because it may mean the difference between life and death. Next one. So this is the last slide. It says we must pass the word along. What word? Why? To be forewarned is to be forearmed. It is a very unusual cancer, yes. But look at this, age is not a barrier, young and old. And gender is not a barrier. Both genders are affected, with males predominantly, especially in the older age group. So we must pass the word along. There's a cancer that many of us have never heard of, but we need to be aware and don't take the doctor's word that everything is sinusitis. Don't work like that. And education is key. Thank you all.
Thank you, Dr. Chang, for your educational approach. Any questions? Any question and answers? Are there any questions? You had a question? Are there any questions?
Question, comment. Not being a part of the medical, I've learned a lot. It was very detailed, and not only that, you can hear me? And it's not only for persons to just hear, but we did not only hear the information, but we got to hear how we can manage some of the information, some of the signs we can look at as just non-medical personnel, and that I would say was amazing. So I really liked the presentation. I learned a lot about what was happening. Thank you.
Me too. I understand now how the gut interacts with the brain. Very informative. Appreciate that. Any comment online? Any further comment? Nothing so far? I haven't seen any question. Okay. At this point, we want to thank Dr. Chang for an excellent presentation, and which was clearly stated and clearly understood, clearly delivered. We appreciate that. Thank you so much on behalf of the Caribbean School of Sciences. Okay, Dr. Chang. Also, I want to thank the audience for joining us today. Appreciate your presence. And I'm sure some of you who have not yet looked at it will view later. All the best and thank you again. You did it in 1 hour. That's good. Time sensitive, eh?
Yes, good afternoon. Hello?
Thank
Good
you all.
afternoon.
Someone
Hello?
has a question?
Yes, I have a question. My name is Ferdy Headley. I want to say hello to Dr. Chang. Hello?
Question, please.
Yeah, my name is Ferdy Headlam. An old friend of Dr. Chang. I want to know, I joined late because of the time difference. I logged in earlier and then I set it up for the time, but I'm getting here late. But I want to know.
Nothing. No. I'm healthy, I think.
Are you hearing me? Is anybody hear me?
Yes, we're hearing
Yes, can
you.
you hear me?
Yes,
Hello?
we're hearing you. Yes, we're hearing
Yes,
you.
I'm concerned about, no, not in concern. I'm inquiring about going over the tape version for later. Because I came in late because of the time difference, because I logged in earlier.
Oh, okay. So you can see the delayed version would be on our YouTube channel. So about a
And
minute after we're through here, you can go to the Caribbean School of Medical Sciences Jamaica YouTube page,
oh, let me
and
get
you'll
that.
be able to watch it.
Caribbean, let me write that down, please, because I'm not in the Caribbean. Caribbean School?
Caribbean School of Medical Sciences Jamaica,
Jamaica, just
CSMSJ.
Medical.
Yes.
You said Jamaica. Do I put J-A or spell Jamaica out?
You can put JA,
Mm-hmm.
or you can put the abbreviation CSMSJ.
CSMSJ.
J. Right.
Thanks. I get a YouTube. Yeah, thank you, Dr. Chang, for inviting me. Good seeing you.
Yeah. Yes.
Sorry? Oh,
Yeah.
you lot,
Thank you.
man. Bless you. Thank
Yes,
you.
yes, Dr. Chang.
That's it. Thank you. Thank you all.